Hello. In this video, we're going to be discussing about the planning which happens in a breast augmentation. Breast augmentation might be very simple. People might think it is just putting in breast implants and forgetting after that, but it's not true. There are a lot of details which are actually taken into consideration, both between the patient and as well as the surgeon. The surgeon discusses all the examination findings with the patient. The patient comes into understanding with what's happening with the measurements, and then we decide to go ahead with the implant. The whole consultation is a process where the surgeon as well as the patient sit together and discuss what the patient actually wants, what are her wishes. Now, during the consultation process, it may happen that the patient may be very realistic in expectations, and this is absolutely fine with us surgeons. So we can actually put in a decent volume of implant in such patients. But where the expectations are really high or even exaggerated, this is the person which needs counseling, which needs education. For the simple reason, if a patient wants, let's say, a very big size implant, and the dimensions of the chest doesn't permit, that's going to lead to a lot of complications. So as surgeons, what we do is we discuss all this with the patients and we tell her the next process is going to be the examination. Now in examination, there are many parameters which we take into consideration. The single most important measurement is the base width. That is nothing but the width of the chest at the level of the nipple areolar complex. We take the base width, and it is this base width which kind of determines what the volume of the implant is going to be. Not only the base width, we also see how much is the skin stretchability, because very tight chested patients may not permit us plastic surgeons to put very big implants. So that's not a possibility in patients who have a very tight skin on the chest. On the contrary, you might also find patients who have very loose skin. So whenever the patient has loose skin, it might permit us surgeons to use a bigger implant. Once the base width and the skin stretchability is measured, the next measurement we do is taking the thickness of the skin near the upper pole of the breast or just below the clavicle, and to see what is the thickness. Now, if the thickness is above 2 centimeters, we can consider putting the implant just below the breast clamp. Whereas if the thickness is very less than 2 centimeters, usually the plastic surgeon would prefer to use the subpectoral positioning of the implant. So this helps us in explaining to the patients what is the position of the implant which is going to be in the breast augmentation. Now, once all these things are done, we come to a conclusion by going back to our catalogs. So we know the base width. Based on the base width, we reference the catalog and we come to a conclusion that this is a particular volume which is going to be used for this patient. Now let's say this patient's base width is around 12.5 centimeters. Now, in the reference catalog, that would give us an indicator as to what is the approximate volume. So we get an idea, and what we do is we also have what is called as a external sizing system, where the patient is made to wear an implant in the bra, and based on the dimension of the implant which we actually get by measuring the base diameter, that particular implant is put in the bra, and the patient stands in front of the mirror and sees for herself whether that is suitable or not. Now, there are two possibilities. The patient either likes it or doesn't like it. If the patient likes it, that's the volume of the implant which is going into the patient. If the patient doesn't like it, either it is big or small. So the patient may opt for an implant which is either smaller or bigger. So this is like, understanding with the patient's wishes, and then we kind of keep the limits within consideration and then go ahead with the perfect implant for the patient. In our practice, we also have what is called as the Cosmetic system, which is the 3D augmentation system, where we feed in the pictures of the patient, and through the software, the software analyzes these measurements and it kind of projects images, simulated images, and these images are seen by the patient in reality, and they can either accept or they can say that they want a little more or a little less. So this is what happens in our practice. So the first process is getting to know our patients, getting to know our expectations, whether they're realistic, whether they're exaggerated, and then educating this patient, removing all the mysteries and myths which are surrounding the breast augmentation. And then we do the physical examination, take the measurements, and kind of help her to choose the correct implant for the characteristics or the features within her chest. And once we finish all this, then we order the implant and the surgery is done after this. The incisions that we use for placing the breast implant is it's called the inframammary incision below the breast, and this is actually tucked in the crease, and you can barely visualize it after the implant is put, and it is absolutely concealed. The other less commonly used incisions, especially in Indian patients, are the perineal incisions, which is around the areola. Because Indian patients are darker colored skins, you can actually see the scar, which is why we don't prefer the perineal approach. So commonly one is the inframammary approach. The least considered is the axillary incision. Why it is not in real vogue is because you cannot really control the inframammary fold precisely by the axillary incision. Although surgeons who are experts may prefer this route, but you need an experienced surgeon to do the axillary technique. This is a round implant that is most preferable by us in our practice. You can see this is a round implant, and it is textured. So you have textured implants as well as the smooth implants. Now it has been proven that the association of the anaplastic large cell lymphoma, the incidence, although is very rare, is negligible or even nil by using smooth implants. So we would use a silicone round smooth implant like this, and textured implants have some amount of association with the breast implant associated anaplastic large cell lymphoma. So textured implants are getting out of vogue for the simple reason that the chances, whatever little it is very less with the smooth implants. Exceptionally, we might be using the anatomical implants. You can see that this has a teardrop shape. It's tapering towards the upper pole, and it is rounded in the lower pole. So in a few clinical conditions, or if the patient really prefers a very natural augmentation, we would be using an anatomical implant like this. But generally, by and large, the round implant is the most commonly preferred implant in our practice. Now, there might also be a lot of myths and misconceptions regarding the breast implant. The biggest myth which patients may have is the possibility of a cancer. Yes, cancer is a very important point to discuss with our patients. However, the risk is very, very minimal. It's almost like 1 in 80,000 patients who may possibly get a cancer called as breast implant related anaplastic lymphoma. This is such a rare complication that we don't consider that our patients need to really worry about this. The second possibility is whether they can feed their children after the pregnancy and lactation. And of course, we plastic surgeons, when we put the breast implant, it is way behind the breast gland or way behind the muscle. So we don't cut any of these breast ducts, and it is safely possible for our patients to breastfeed their children. It helps our patients to boost up their inner image and actually boost their confidence and get back to their routine daily lives. So it's absolutely safe considering that it's done under general anesthesia, and the recovery is also very predictable, and they can get back to their routines within 1 to 2 weeks of time. And all the strenuous activities like gymming and the other physical activities can probably resume after 6 weeks of time.